I am Barnachea, or my students call me Sir Neil. Um, and I work here at the Center for Counseling Services as a counselor. I've been here since 2002. Okay, and I handle students right now. I handle students who are taking up information systems, and as well as those in this career development program, or CDP. Those who are taking up business management and marketing management. Okay, persons who are with ASD or Asperger's syndrome are those individuals who have difficulty in terms of socializing with others, interacting with others, those with behaviors that are considered as not normal to others. But simply put, it is just it is a condition in which people or persons with ASD have difficulty in relating with other people. There are no known causes of Asperger's syndrome. According to the research studies that I have gone through, that I have read, there is no specific cause or causes. There are no specific causes. They only point to certain factors that can lead to Asperger's syndrome, like the parents might have been involved, or might have been contaminated with certain chemicals. Especially the mom might have taken medicines during her pregnancy, which could have affected the growth of the baby inside, or the fetus inside. Now, since this kind of disorder is focused on the relationship aspect of people with ASD, they have difficulty in terms of interacting with others. They tend to clam up. They tend to isolate themselves from others. But that doesn't mean that they are lonely. They only prefer to be by themselves. As far as I know, they are very creative. They are talented. I had one student before who was very good in designing, in the arts, and that's his gift. And at the same time, they tend to be very good at one area, like design or arts. As of the moment, I'm not really sure about how Asperger, those with ASDs, are being managed. But I think they are. They also have to take drugs or medication. I mean, to manage their condition. And of course, this is being they are being addressed by a developmental pediatrician. First and foremost is the relationship aspect, the socialization aspect. They need to be incorporated with a group of people. They need to interact. They need to acquaint themselves with what is going on in a community, or in a group. In other words, they need to expand their set of friends. Since they would like to be by themselves, they have difficulty most of the time in dealing with others, in interacting with others, because they tend to isolate themselves. They have a world of their own. Sometimes their interests are not the interests of those people around them. So as a consequence, they tend to do things by themselves. First and foremost, since their main concern is about socialization, the community to which he or she belongs to should have a support system for these people. In other words, the people in the community should be aware of the condition, the situation. They need to be open-minded, understanding, and accepting in terms of dealing with these people with ASD. And if and only if they accept them as part of their community, um, the those with ASD would be supported in terms of their needs.